First thing you're going to do before you go into your patient's room is you're always going to try to check your physician's orders. You're going to make sure it's the right person, the right room number, and the right procedure. When you're going to come in, you're going to introduce yourself, and you're going to be performing hand hygiene while you're introducing yourself. My name is Isaac Fowler. I'm a Bevel State nursing student. I'll be assisting your nurse today in a dry dressing change. And you're going to ask them to identify their name and their date of birth while checking their armband. And while you're doing that, and then after that, you're going to go into explaining what you're fixing to do, your procedure. What I'm about to do is a dry dressing change. We're going to take this old dressing and we're going to remove it and replace it. And we're going to clean out your wound while we do that. Next, I'm going to gather all my equipment. This paper towel here symbolizes that my area is clean. I'm going to take my 2 4x4 gauzes. I'm going to peel that back and set it under like so it'll be easy to get to. Then you're going to have your solution and your paper tape, and you always have your gloves, and you're going to have your disposal bag. First, you're going to want to don your gloves before you're about to remove the dressing. Alright, the first thing you want to do is when you go to remove your dressing, you're going to try to pull towards the wound all the way around and try to loosen up your tape so where it's less strain and pain on the patient, because this is a very tender area. And once you've loosened that, you want to bunch it up, and you're going to start observing on the dressing your coach, which is your color, your odor, your amount, consistency, and how well they tolerated it. And that's what you're going to be observing from your dressing, so you can document it later, and then you're going to dispose of your old dressing. And after that, you're going to want to look at your wound. While you're moving on in your next step, you want to be able to sure to look at your wound. What you're going to be looking for is RETA, which is redness, any edema, emesis. You're going to be looking for any drainage, kind of amount of drainage. You want to make sure that you document your drainage, and approximations is in how long, how wide, gaping, anything like that. Any details about your wound. The next thing you're going to do is you're going to take your 4x4s. First, you're going to want to change your gloves, because we're moving from contaminated procedure into a clean procedure. And you're going to want to remove your gloves and dispose of them, hand hygiene, and replace your gloves. And then you're going to wet your 4x4s with your solution. As you wet your 4x4s with your solution, and you're going to kind of bunch it up. You always want to start farthest away. You start farthest away from your wound, because you always want to go cleanest to dirtiest. And you want smooth strokes. You don't want to be dabbing or anything like that on it, because that could irritate the wound and cause more pain. And then after you get farther away, you're going to go on to nearer, middle way towards your wound. Always strokes, clean strokes. And then you want to get close to the wound. Then you want to take another dry gauze pad, and again, you just want to kind of pat that dry. You want to pat your wound dry. You don't want to be rubbing or anything on it, because you don't want to irritate the wound anymore. And then you're just going to take your dry gauze pads, and you're going to always make sure to grab the pads from the side that is not going to be touching the patient. I'm going to grab the pads from the side that's not touching the patient in order not to contaminate them. You want to keep it clean. And then once you have that on there, you can remove your gloves, because the next thing you're going to be doing is taping, which is easier to do without your gloves. And you're to a point to where the wound has been covered, so you no longer have to keep your clean. So you're going to take your tape, and you just want to get all the way around the dressing. You want to make sure you firmly secure it. You always want to use your paper tape, because that's going to be easiest on your patient. I'm going to go all the way around it. And see that I went all the way around, and then there's the when you have the two, you kind of have this sticking up, and it's good to go ahead and try to secure it too. Just make sure that it's secured in every way that you can. And once you have it secured, the next thing you're going to do is you're going to make sure to take a piece of tape, and you're going to want to date and initial it. So the next person who comes in to dress and change will know when the last time that the dress and change was changed. And then you have your date and your initial. And you just want to put that on there. You never want to write that on the dress and change, because you don't want to put any extra pressure. And then you're going to make sure to ask them how they tolerate it well. If there's any pain, make sure to tell them to report any more pain. If any more symptoms show up, ask them if there's anything else that they need. Then you're going to always perform hand hygiene as you walk out, and leave a call right in reach. And you're going to go document all your findings, your coach and your Rita, color, odor, amount, consistency, how they tolerated it. You're going to want to also do your Rita, which is your redness, your edema, your osmosis, your drainage, and your approximations of your wounds, your gaping, everything like that. And then that's it.